In today's video, I'm diving into 20 questions that you need to consider before having fractional CO2 laser for anti-aging. I'm Dr. Cole, a plastic surgeon in Atlanta. Let's make sure you have all the information you need to make a decision on your aesthetic treatment.
I'm going to answer every question that you have on the fractional CO2 laser right now. First question. Why did I have 3 treatments 3 years in a row? Isn't one treatment enough? I had 3 treatments 3 years in a row because I was under the assumption I had to do a CO2 laser treatment every year to maintain perfect skin. I was wrong. It's been now 4.5 years since my last CO2 laser.
So I think that it's a very good point that she made, which is you do not need to have CO2 laser every year. Most people, I recommend they do it for their best result about once every 5 years. And I have many people that haven't done CO2 laser for 20 years and their skin still looks fantastic.
And my skin still looks very good. I intentionally wore no makeup for this video because I want you to see how my skin actually looks.
Isabella does have great looking skin, and it is because of the CO2 laser, but she's correct. You do not need to use a CO2 laser every year. I recommend people to do it or consider it about every 5 years. I have many people, many patients that have had it 20 years after CO2. I still see them. They still literally get stopped at a mall and people tell them they have great looking skin.
Second question, is there a downside to having too many CO2 laser treatments? Yes, if we have too many CO2 lasers, we risk getting our skin too thin and then the skin starts to look creepy, therefore aged, which defeats a lot of the purpose of the CO2 laser treatment. I was fortunate enough because my skin recovered 100% after each treatment, probably because I was still fairly young in my mid-30s and my skin had the strength to regenerate and recover. I do want to add, I am glad I had 3 treatments 3 years in a row because I believe the aging clock has been reset for my skin. I am now at the age of 41. And I still have no lines and wrinkles on my face. While I'm glad I did that many treatments that frequently, I would not do it again because it is risky.
She makes some good points and some that aren't really made that I want to highlight. One is she's glad she did it 3 times because her skin looks great. Her skin would have looked great if she only did it 1 time. So the other 2 were really not necessary to do that close. The one time I do recommend we do what I call graded treatments is some people can't take off for 2 weeks, 2.5 weeks. And so we can do a lighter treatment 3 times to get the full effect of a CO2 laser by doing it in a fractionated fashion. Some people like that approach. Even though they have 3 downtimes, they have 3 brief downtimes that fits their lifestyle or their work better than 1 longer recovery. So there are options to consider and something you should talk to your doctor about.
Third question, what's the recommended frequency for a CO2 laser? Every 5 years.
She's very accurate. Every 5 years is the recommendation, but it does vary. It's really not a cookie cutter thing. It depends on your skin type, your thickness, how much pigmentation you have. There are many variables, but I would agree on average about every 5 years to have your best result.
Question number 4. How is the actual treatment? Does it hurt? Based on my experience, the actual treatment is the easiest part of the whole process. For the first 2 CO2 laser treatments, I was under general anesthesia. For the third one, there was a new CO2 laser machine that came out. For that one, it's only required that my skin was numbed. I also got a pain pill and a Valium. I was relaxed, I was laughing and chatting with the doctor the whole time.
So I definitely agree you do not need to have general anesthesia, but I will say a lot of times people are getting a CO2 laser, they're also getting some other facial rejuvenation procedures. So if you think of it, it's almost like if you're doing surgical procedures on deeper layers and you're going to have the CO2 laser done to improve the quality of the skin, it's easier to go ahead and do it under general. But if you're doing the laser alone, you definitely do not need general anesthesia.
Question number 5. What does the fractional CO2 laser actually do? The fractional CO2 laser treatment fixes all skincare concerns except brown spots. For brown spots, we need an IPL treatment or hydrocodone cream or a combination of the two. The reason I'm such a big fan of the CO2 laser treatment is because it virtually is one treatment, one recovery, and I'm done.
So number 5, I completely agree. It's an outstanding procedure for all blemishes, but besides pigmentation, it also is not completely specific for vascular lesions. So if you have some little spider veins and things like that on your nose, it's better to have that done with a different type laser. But as an all-purpose laser, the CO2 is the absolute gold standard.
Question number 6. Does it tighten, lift the skin? Yes, it does. It really fixes everything. It is the holy grail of skincare and anti-aging. However, depending on your age, do not expect the results you would get from a facelift. If you are in your 50s, you will get skin tightening, but it won't be as dramatic as you'll get it from a facelift.
So that's partially accurate what she said, which is the skin does tighten very well, but it tightens over the muscle layer. So if the muscle layer is sagging with age and gravity, then even though you're going to improve the skin, it's not going to do any lifting. It's only going to tighten and recondition, or what we call resurface the skin.
Question number 7. Does it get rid of lines and wrinkles? Yes, it does. It's really the holy grail of skincare and anti-aging. However, my dermatologist told me, even though I hated hearing that, the older I get, the CO2 laser will be less and less effective at completely erasing my lines and wrinkles because my skin regenerates slower and slower. It will get rid of lines and wrinkles, but it will be less and less the older I get.
So there are several kinds of things to think about when you talk about wrinkles. One is what we call a dynamic wrinkle, which is when you smile and you get lines on the side. That's from a muscle contraction. And there are wrinkles that are called static wrinkles, what are wrinkles at rest. And those are the fine lines. It is correct that as you get older, it will have less effect. But it's not because the CO2 is not doing its job and helping the skin. It's because you're having more muscle laxity, and gravity is allowing the ligaments in the face to allow tissues to sag. So as you get older, really what you need to do is make sure you complement the CO2 laser for quality of your skin with surgical tightening. If you don't do any surgical tightening, the laser will seem to not be as effective, but it's only because it doesn't lift muscle.
Question number 8. Is there anything I can do to make the results of the CO2 laser last me longer? The answer, absolutely. Make sure you have a good skincare routine before you do the CO2 laser and after, a skincare routine that consists particularly of sunscreen and retin-A. Even though I am 4.5 years since my last CO2 laser, my skin looks really good. Is because I am boosting the results I got from my CO2 laser twice a day, morning and night. I also want to add, if it was up to me, if you don't have a good skincare routine, I would not put myself through the horrendous recovery of the CO2 laser. The recovery of the CO2 laser It's absolute misery. Don't put yourself through that miserable recovery if you don't have a good skincare routine that's going to maximize the results you're going to get from that treatment. First, if I was you, I would work on getting a good skincare routine and then do the CO2 laser treatment.
She had several interesting topics that she tied together, and one, which I very much agree, is a skincare. But think about it, skincare is something that you're doing externally. And we all know beauty starts from the inside. So just like your mom used to say, you know, you are what you eat. And so you want to have a very balanced diet that's very nutritional, that covers the vitamins and biotin and all these things that help your skin. The other thing is you can recondition your skin from the inside out. And so there are procedures we can do with the laser that we can tighten the internal structures through the mouth, behind the eyelids and things like that, that will keep the skin looking fantastic with no scars, no signs of having anything done except beautiful skin.
Question number 9. The recovery is tough? Yes, it is. It is 7 days of pure misery. Worth it? Look at my skin, but 7 days of pure misery.
Her number 9 comment is really interesting because she's right in that you get a beautiful result. She said earlier it's not painless. So I really think what is meant in her case by pure misery is how it looks. Because the biggest complaint that I get from people is that it's messy and that it's intimidating. So like for instance, I'll tell them, make sure you have old sheets, an old pillowcase, because it's going to get messy with the lubrication that you have to use. The other little trick I tell people is if you have young children, bring them into the room and keep the lights out and talk to them, hold their hand, let them know that it's mom or dad, then turn the lights on and show them what it looks like, and you all get a good laugh instead of them being scared thinking that you got burnt by a blowtorch or something.
Question number 10. Will I be in pain during the recovery? No, you will not be in pain, and your face will feel comfortable.
So again, comfort is key. And as long as you're comfortable, and the hardest thing is don't look in the mirror, because the first few days are tough. You do look like you have a controlled burn, and effectively you do. It's a very controlled laser burn to give you a full effect once you heal.
Question 11. Then why is the recovery 7 days of pure misery? I did a previous video that focuses solely on the day-to-day recovery, and I'm showing pictures for each day of the recovery. I'm going to link the video below. It looks horrendous, but you are not in pain. You're going to see in the video once you watch it.
Like she said, there's no pain, but she calls it misery. I call it the frustration phase. I tell everybody ahead of time, it's going to be very frustrating. You're going to feel fine. You're going to look awful. Everything's healing. Your friends are going to want to come see you, and it's frustrating because you feel good, you want to be healed faster, but it takes process. I mean, you have to, remember you're erasing years of sun damage and things to your skin. So to take a week to heal, it's definitely worth it.
Question 12. Will my face look normal after the 7-day pure misery recovery? Yes. Once the Vaseline comes off, and there's Vaseline involved during the recovery, you're going to see in my recovery video. Once the Vaseline comes off, your face is going to look 100% normal. We can wear makeup, we can go in public. The only thing that's going to be left is redness. And depending on the person, the redness takes a few weeks to a couple of months to completely go away, but makeup will cover any residual redness.
There you go. Great result at 1 week. The only thing to think about is for ladies, it's pretty easy to wear cover-up makeup. For guys, it's a discussion that you need to have. There are tinted sunscreens that I recommend to my male patients, and they're okay with that, but some people like to do the laser only around their eye area because that's the area that shows the most, and it's also the area that's easiest to cover with tinted makeup or even sunglasses.
Question 13. What are the risks? First risk infection, make sure you find a good doctor to minimize that risk. The second risk is scarring. Make sure you follow the instructions to 100% you receive from your doctor on how you're supposed to care for your skin after the CO2 laser. If you have questions, ask a million questions until you know for sure you know how to care for your skin. The third risk, there's risk of hyperpigmentation, which is brown patches on the skin. I got the brown patches on my skin after each of the 3 treatments, but it's easy to get rid of them. You just have to use hydrocodone, which your doctor will provide for you.
She highlighted one of the minor but more common risk, which is having what I call cafe au lait spots, because that's the color. It's just a light tan on your skin. And what happens is if you're just driving out and picking up one of your children, going to the grocery, going to a doctor appointment, you still get sun exposure. And so it's very important to wear hats and scarves in the beginning to protect yourself. The other thing is the main risk for infection is not just your doctor, but it's yourself following instructions, because where you're going to get infection is usually going to be from home. And so it's very important you can't get in a hot tub, for instance. You don't want to cuddle with your animals, things like that, until your outer layer of skin, called the epidermis, has healed. Then you're not at a high risk for infection.
Question 14. When's the best time to do the treatment? Not summer. The best time to do it, it's in the fall or the winter.
Well, certainly, being in Atlanta, that is something I agree with. But summertime in some places could even be winter climate. It just depends on where you are. And the key factor is sun. Make sure you're not doing it around the sun.
Question 15. Can I tan if I do a CO2 laser treatment? Based on my experience, once your skin is healed, you can tan. I go in the sun every summer and I like to get very brown, but sunscreen, sunscreen, sunscreen. You can tan, but do not tan with your skin unprotected. I
fully agree. One of the kind of jokes that I tell all my patients, and it's well known in my office, is that's what lasers are for. Go outside, have fun, be in the water, get a tan, be one with nature. That's exactly the reason we do these treatments, is so that we can have our cake and eat it too.
Question 16. Can I do the CO2 laser treatment on any other parts of the body? Yes, you can. I did the CO2 laser on my face. I also treated my chest one time.
The CO2 laser is targeted toward water, which is the highest component in skin. The skin heals by the material in the follicles of the hair shaft that go up the hair shaft and allow the epidermis, the outer layer of skin, to heal. We can treat some other areas like neck and the décolleté chest area, but it's a higher risk of complications. So the best treatment is definitely the face. But I have certainly treated necks, chest, hands, and other areas.
Question 17. What's the toughest part of the CO2 laser? By far, it is the recovery, specifically the Vaseline, which has to stay on our face 24/7. You'll see in my recovery video.
It depends on how you look at it. My patients say the hardest part is finding time to recover, because we all have such a busy lifestyle. And one tip that I'd like to give y'all, that I tell all my patients, is Dawn dishwashing liquid soap. That cuts the Vaseline. You just use it one time at the end when you wash your hair, and that Vaseline's history.
Question 18. What's the best part of the CO2 laser treatment? Oh my goodness. Of course, the results. Look at my skin.
Without a doubt, that's everybody's favorite result. I have many people that have told me they've never had people comment about their beautiful skin. I had one person that had bad acne scarring, and we did need to do 2 treatments to give her the best result. But to this day, she says her favorite part about going shopping is not to try on and look at clothes, but she always gets comments about how beautiful her skin is.
Question 19. Describe the CO2 laser treatment in 3 words. Horrendous, but amazing.
I love it. I would say absolutely worth it would be my 3.
Question number 20. Will I do the CO2 laser treatment ever again? Oh my God, I want to do it again. Next fall, it's my 5-year mark. I am prepping myself emotionally to do it again because I want to do it again. I had my first treatment at the age of 34, 35, 36. I am 41 now.
Isabella's a great example of somebody that's a beautiful lady that looks even younger because of her CO2 laser. And I cannot think of a patient I've had that once they're through it, they don't love it. I do sometimes call it the love, hate, love stage. That frustration phase is tough, but it's very brief, and you get years and years of great looking skin, compliments, go swimming, all those things you don't have to worry about any makeup. Please make sure to subscribe and let me know what you think in the comments.